were a few posters on the results of antisense oligonucleotides targeting exon 45 and 53. And I think what is interesting is to see the consistency of this data. At the time when the eteplirsen data that was targeting the mutations eligible for skipping 51 were available, there was evidence of some increase in dystrophin and some delay in the progression of the disorder. And it's very nice. I think it's very reassuring to see that even using different compounds which are targeting exon, the deletions amenable for skipping 45 and 53, we still see this consistency. We still see production of dystrophin. We still see that not the first year, but with increased time after the first year, these children are still deteriorating, but not as fast as the children who have the same mutations but aren't treated. And I think this is very important because it shows that the mechanism is working, and that using these drugs over time, we can probably reduce the progression of the disease and delay the time at loss of ambulation.
So for the exon skipping compounds, we have eteplirsen for skipping exon 51. We have golodirsen, which is for skipping exon 53. And we have casimersen for skipping exon 45. There is now longer-term data for eteplirsen since the studies were done a while ago, and also it's been approved by the FDA. Accelerated approval was obtained, and so we have patients being treated on that too. There was a poster that showed the dystrophin results for the three various antisense oligo skipping products. There were also data on the clinical outcome of the eteplirsen, which is compared to natural history controls, that showed there was a difference in the motor outcome in loss of ambulation. And for the golodirsen and the casimersen, it's a later phase study, so we do have preliminary data. And for atuluren, that's not an exon skipping strategy. Atuluren is for the group of patients with nonsense mediated mutation. That means their mutation resulted in the premature stop. That's an oral drug that had approval in Europe, but not yet in the US. And that one has got longer term data because the trials were started way back in, the study started way back in 2006. And they also had a registry that is set up in Europe to track the real world outcome of the patients that had been on open label extension of the medication. So I think all in all, it's showing a trend to improve the ambulatory status by a couple of years. And there were some posters that also were able to share their data on the impact on pulmonary function. So yeah, there were quite a lot of updates in those areas.